Again, we use the cap for the nurse and also a mask. And it's just recently that we've been putting masks also on the patients. There's a lot of patients that don't like to wear a mask, so we ask them if you could please turn your head the other side while we're doing the dressing changes, and you can do it that way if they refuse to wear a mask.
And why do you think we want them not to breathe on it, even though it's their own germs?
Still
They're
bacteria.
Right, you can still transfer bacteria, right?
Oh, yeah.
From one side
I don't have to put it
of the
on.
body to the other?
All your hair
Oh, yeah, I showed them the right way to do it.
So I have long hair, so
No
everything
hair.
has to be in.
So there's no mirror in the kit?
Okay, of course we wash our hands before doing this, and then before I do my dressing changes, I usually just ask the patient if there's any problem with the, flushing at home. Oh yeah, all of a sudden I cannot flush anymore, and then they'll start telling you what's going on. And we assess for any tenderness or pain or hardness, especially the shoulder pain and neck pain, because those are signs sometimes of deep vein thrombosis. So if they do have those symptoms, we need to call the doctor for referral for ultrasound or vascular study, make sure that they don't have a clot. Also, is swelling. Those are one of the reasons also when they have swelling is they develop also DVT. So we measure the arm circumference. I'm one of the Picc nurses, so when I insert my Picc, I usually measure my arm circumference from the antecubital 4 inches above it. And that's how I make sure my arm circumference. So if you want to, look at the how much is it, then you just have to measure from the here, 4 inches above, and that's how we measure. And if you notice that this arm is a little bit more swollen than the other, then that's how you can tell, oh, there's a discrepancy there. It's a little bit more swollen. Okay. So I use just regular gloves just to remove the dressing. After you wash your hands. And then we slowly just remove this. A lot of our patients also are have a very sensitive skin and older people, so we use either alcohol or the adhesive tape remover just to remove the tape, because a lot of them it tears the skin right away. So this is a great idea to just use it. And this one's really sticky too. And when you do the dressing changes, you try to do it this way towards where the insertion site, because if you're pulling it this way, you tend to pull out most of the catheter, and it can stick into the catheter. So that's why if you try, please try to do it, against the insertion site. And then before I even do my dressing change, I look at the history already, so I know how much is my external. So that when I'm already there, oh my God, I don't know how much is external, because right now there's 4 centimeter, and I'm like, is that the original, or it got pulled out 4 already? So you know already what to look for.
So do you have a special tape
Yeah.
measure?
It comes with a kit already and everything in there
I see.
too.
Okay.
And then I will show you how to measure from the side from 1 centimeter going up, okay? The inpatient Picc nurses, they tend to have a lot of external out. That's how they do it. When I put a Picc line in the outpatient, we put everything as much as possible to 0, because a lot of our patients are outpatients, so they move a lot, they do a lot of things, so it has lesser tendency to get pulled out. But in the hospital, I guess they leave a leeway just in case, they have to push back or they need to reposition or something. But most of our patients are outpatients, so that's why, if possible, you want it up to 0. Okay. But in some instances, we put it too deep, so we pull it out, and that's how you could tell, yeah, there's like 2 to 3 out right now. And most of the time we tell the patient also, like right now you have 3 centimeter out, so when your nurse asks you how much is the original, I just ask the patient, oh yeah, the nurse told me that I have really 3 out. So it's a lot easier too.
Just to remove the old tape. It's taking
It
a long
takes
time.
It's fortunately we get a lot of dressing changes, and a lot of our patients also, we don't get a blood return, and we don't just ignore if you don't have a blood return. you're doing a lot of assessment. We send them for x-ray, we declot. So for a 45-minute dressing change, it came out to be 3 hours, fortunately. Greg knows that, right, Greg?
Oh, yes. Sometimes you just never know. And, you know, no blood return could mean that they actually have a clot at the end of the catheter.
Like a partner.
That is not allowing you to draw blood. And so clots at the end of the catheter draw bacteria. Bacteria draws infection. And so we want to get rid of that clot as soon as we know about it.
This one really stick, Greg.